operation or something like that. So, but I will have to show you the, okay, because if you're about to assist, okay, or perform a surgical wound dressing, yung pagkatapos ng operation, right? Dadalhin sa'yo, so meron siyang tahi. So, kailangan mong linisan. Okay? So, you will have to use a surgical gloves. Okay? But yung gagawin ninyo during your practicals is just a clean wound. Okay? Kasi mabilis yun. Kasi wala naman kayong lahat, meron kayong surgical gloves. Okay? So, we'll just use the clean gloves. Okay? But I will have to show you how to do, wear your gloves, your surgical gloves, if you are assisting a surgical or cleaning a surgical wound. Okay, so we have to observe an aseptic technique or a sterile technique. This is sterile clean technique. So the concept of sterile technique is sterile plus sterile is equals to sterile. So if you are sterile, you are only allowed to touch a sterile part. If you are unsterile, you're only allowed to touch unsterile part. Okay? Kung malinis ka, malinis lang dapat yung area or part na i-touch mo. Okay? Pero kung yung kamay mo hindi naman malinis, dapat yung part lang ng gloves is the unsterile part ng ano mo. So which is, if my hands are considered unsterile, even though I do hand washing. So I do hand washing, but still it is unsterile. Okay? So when I open the sterile gloves after the hand washing, this is the surgical glove, right? So I will have to identify which part of this glove is sterile and which part of this glove is unsterile. So this part inside the gloves is called or is considered as the unsterile, not clean. Okay? And then the part of the gloves that is outside the gloves is called the sterile or the clean because it will be the one to touch. This area is to touch the wound, the skin of the patient. So we make sure that it's not contaminated. It's still clean because you will have to touch the sterile part or the clean part, which is the wound. So my hands is unsterile, so I'm only allowed the unsterile part. Unsterile plus unsterile is equals to unsterile checked. What if I accidentally touch this outer part? I need to remove my gloves and then go out and then do hand washing and do it again because you're breaking the sterility concept. Okay? So you will have to go out. Okay? If you're in the operating room, you need to go out. If you are cleaning, you need to remove and put it again because you already compromising that. There will be causes of infection. Because again and again, you cannot see these microorganisms. You cannot see the infection. They're like, ay, it's okay. It's wala pang 3 minutes, wala pang 2 minutes, okay lang yan. Okay, nakikita mo ba yung mga dumi? Hindi, right? Okay? So, unsterile part is my hands. So, I have to touch the unsterile part and then I have to check on how to insert the proper placement of my fingers. Then I have to insert it. So, what if it's not fixed yet? Okay? It's not fixed yet. I'll just leave it like that. Okay? Then, I will have to fix it later. So, now, the surgical gloves is already inserted in one hand. So I can now touch, because this is already sterile. My hands is already sterile with the gloves. So I can now touch the sterile part of the gloves, which is the outer part. Then I can hold it. Sterile plus sterile is equals to sterile, right? I'm not breaking any concept. Then this time I have to, slide my fingers into. Then I just have to hold it on this part and stretch it for me to insert my finger and my hands inside. Now I can now fix. Sterile plus sterile is equals to sterile. Right? But if I accidentally touch, get out or change another one. Okay? Huwag magtipid. Kasi yung problema, yung pasyente mo, tinipid mo na rin. Right? So you just have to insert it, and fix it. Same thing, fix it. Then this time, if you, make sure, so ideally you need to remove everything, your jewelry and everything, right? So I'm now done with my gloves, Then, in order for you to maintain sterility, for example, you are assisting the doctor for the operation. So that's why you're seeing doctors or surgeon that they're keeping their hands up like this when they move, because they're maintaining sterility. Because the area from the waist going up is the sterile area. The part which is from the waist down is the unsterile area. That's why when you accidentally drop your or put down your hands, then you are already breaking the sterility. You need to get out from the surgery or the operating room and then do it again. Okay? So when you are assisting, you do not put your hands like down, but like this. And then prepare. Because this area, because the patient is here. So it should be clean, maintained clean. Okay? So accidentally, oops, I'm sorry, I need to remove. How will you remove? So this time now, if you have touched the wound and everything, this outer part is already considered as unsterile. Madumi na siya. Kasi nga, syempre, nakahawak na sa wound. So this time, this is the unsterile, and the sterile is already the inside part. It's already the hands. So you have to pinch it here and slide, okay, out. Throw it to the hand, and then you just have to insert your fingers inside because this your hands is already sterile. You have to, okay, sterile to sterile, and then you throw it, and then you do the hand washing. That's how you perform or done your gloves, or specifically your surgical gloves. Okay, let's start with your dressing change and wound care for a clean wound or the open wound. Okay, so let's do this. Can I just ask somebody, sino ba pwede itong pasyente?
Debbie.
Wala, may busy si Roger.
Debbie. Akala Roger, ikaw na.
Okay, ikaw na Roger. Sige, upo ka. Kuha ka ng chair.
Ikaw na lang. Roger talaga.
Okay. So yung na-perform nyo sa practical later. Okay? So, tatanggalin mo muna yung mamahalin mo. Okay? So, gagawa tayo, pag join sa practical, gagawa tayo ng imaginary wound, ha? Okay, para imaginary wound, hindi pa ako nag-umpisa, gagawa lang muna ako ng dressing. Okay? Yung old dressing. Assuming na ito yung soil or yung old. Kasi pag dating ninyo, andyan na. Hindi man kayo nag-opera, right? Or hindi man kayo So pagdating nyo, ang trabaho nyo lang is to change the old, apply the new dressing, and clean the dressing or the wound specifically. So I'll just have to do, lagay ko muna to before ako mag-start. Secure ko muna kasi I'll have to show you how to remove.
Si Roger.
Okay, so now the wound, the dressing is already